Dr. Rochelle Walensky will depart the CDC on June 30th of this year, and your colleague and friend, Dr. Mandy Cohen,
Yeah.
has been appointed as her replacement. Dr. Cohen is a physician and a highly respected public health professional who worked at the state level of HHS. And as the chief operating officer of CMS, she helped lead North Carolina successfully through the COVID-19 pandemic. And so most certainly she is highly qualified.
Yeah.
What are 3 issues do you believe the CDC needs to get right to regain the trust of the American public?
Well, that's a great question. And I think that is number one for CDC right now, is regaining broad public trust by demonstrating that coming out of COVID, played a critical role in COVID, but coming out of COVID, it can do more to address the public health challenges facing the nation. This is a very challenging time for CDC to do it. There have been, some proposals for giving CDC more resources, more authorities. There's just not consensus out there that could enable that to happen. So Dr. Cohen's going to have to work under the current CDC authorities and current resources to find a way forward. But Patty, I can't think of anybody who would be better in this job than Mandy Cohen right now. In North Carolina, she was able to implement a number of steps and work very closely with the state at Duke Margolis on many of them to enable public health and healthcare to work better together. For example, sharing data so we could focus efforts on informing people about their vaccine options and helping make sure they had access, also for tests and treatments as those became available. She collaborated closely with researchers, some of my fellow faculty members and staff members at Duke and Duke Margolis on issues related to school safety. And North Carolina was one of the states that reopened schools very early compared to much of the other country, essentially when the school year started in the fall of 2020, with some steps around testing and masking that had some controversies, but that had the main effect of getting kids back into school despite the challenges we're working through with COVID. And I think she's going to bring that same approach of being able to work across the aisle, finding ways for public health to partner with healthcare, with business, with local community leaders when she gets to CDC. And so I would put at the top of her list, number one might be how we work together better in the next public health emergency. We have the technologies now, the medical technologies, so that rapid access to diagnostic tests to figure out what's going on and contain it, and then treatments, both off-the-shelf treatments that work because we know what kind of bug this is, and as well as synthetic treatments like monoclonal antibodies. Those can come along quickly, and vaccines too, but it's going to take a new way of public health working with healthcare to take advantage of that and enable us to contain future outbreaks without restrictive public health measures, and with much better information that we can get from frontline healthcare providers to support it. Second, I think there's some opportunities around many other chronic diseases where healthcare and public health could work together better. We have early diagnostic tests now and good, if not curative, treatments available for everything from hepatitis C and other infectious diseases, flu, et cetera, to chronic conditions like diabetes and pre-diabetes. And then I think third, around trust, we've got people are in this country are getting their information they trust from a lot of different sources. One thing that many Americans have in common is that they have a health professional, a physician, a nurse practitioner, a pharmacist, a clinician that they rely on. And instead of public health maybe focusing so much on having press conferences, maybe having public health leaders work more closely with frontline trusted healthcare professionals out in the community, making clear, what do we know now? What do we not know about both public health threats and, just chronic diseases, vaccines, treatments? I think there are a lot of opportunities there, but I do really think Mandy Cohen is the right person, the right time, a very tough time, an important time for the CDC.
I am so incredibly excited about her moving into it and living in the state of Florida. The idea of public trust and working
Yeah.
collaboratively with the health professionals on the front line sounds like a pipe dream, but one that I would like to sign up and see it in effect.
Yeah. Well, it should
Up
be
and out.
possible. I mean, we've got better electronic data systems in healthcare. And you think about like, where people do get their trusted information. We just need to make it easier for people to connect to their clinician, make it easier for clinicians to get the right up-to-date information on new drugs, on new public health threats, et cetera. So I'm pretty hopeful we can do more by bringing these traditionally separate approaches more together around, what medical technology can do. This is where we started, right? What medical technology can do, and how all of us can make it easier for Americans to make informed decisions and stay healthier.
We're almost at the top of the hour. Do you have any closing thoughts?
Well, I really appreciate the time we've been able to spend together today. And I know that none of these issues that we talked about today, whether it's the IRA implementation or the future of public health, none of them seem like they have easy solutions. Seems like a very challenging time for the country right now. I would just encourage everybody to remember how much potential we have to work with. The biomedical technologies are better than ever. The arc of history, if you want to call it that, is definitely moving towards earlier diagnosis, more consumer focus and consumer supportive healthcare that you can get at home. My day job with the Duke Margolis Center is really about how do we develop policies at the national, state, and local level to accelerate progress in that direction. But because there is so much potential there, Patty, despite the challenges that we're facing today, I'm very optimistic about the future.
Mm-hmm. I'm really glad to hear that. Thank you, Mark. I
Great to be
appreciate
with you.
it.